Welcome back, Richard. It is Thanksgiving week. We have finally made it.
Yeah, but here's another month that slipped by. You know, at the end of this week, we're going to be in December.
Right. Yeah, it's pretty astounding that because it's that interesting phenomenon where it feels like it's dragging and taking forever, but at the same time, it feels like it's going by so fast.
I know. It's like those movie scenes where the calendar flips by real fast. You know, and here we are in almost December. I guess Miss Cassie would have it all calculated by day, you know, 20 to 35 shopping days.
That's probably true.
But who can even think about it, right?
That's right. But it also seems like it's been so long since like the pandemic started, and you know, March seems like an eternity ago. It feels like we've been doing this for forever. And but today we're going to talk about some interesting relationships or correlations between what we're going through now and something that our country went through about 100 years ago in 1918 with the influenza, and really talk though about how what happened then can be used now to make better decisions and to help us understand the importance of some of the things that are happening.
Right. Yeah. It's not just the scientists. There is this epidemic in 1918. We've talked about it before, that informs us today. I mean, if you want to know how to do this, what we mean by doing this is, here we are with a pandemic that is surging more or less out of control. I think it's safe to say. You know, Japan has hit record highs. Toronto is going to go into lockdown on Monday. The National Guard has gone to El Paso to provide assistance with their morgue crisis. They don't have enough. They have to have a temporary morgue. Mississippi had the highest single day. Hong Kong has the highest rates. California is beginning to shut down. Right. And my son lives in Texas, and he said the Austin public schools are considering another shutdown. For this time. And I don't know, are they saying anything in our county about?
Not about a shutdown, but there was a report last week that the state has said that they will extend funding for e-learning through the second semester.
Oh, okay. Now, we weren't sure about that.
Yeah, some of the individual school districts haven't said anything about what they're going to do specifically, but there was a news report about that. So
yeah, I suspect that if it rages out of control, they're probably going to shut down either during the holidays, maybe in November and December, or they won't reopen fully in January as planned. You know, because in Florida they had planned a full reopening in January. But it's unlikely that that's going to occur because of these rapidly rising numbers. So between April
and if they continue, the numbers are even crazier.
Yeah, because since April, in April we had 1 million in our country. We had 1 million cases, and now we have 12 million cases. So if you do the math, I mean, a little over 1 million a month. By January, February, we're going to have some serious numbers. And it's going to overwhelm. The problem is it'll overwhelm the hospital systems, you know, plus the tragedy and the destruction that this thing has caused. But we do have this.
As we've talked about before, you know, there are those who say, well, the higher the number of cases, the faster we'll get to that, you know, herd immunity and those kind of things. But it doesn't look as though that's going to happen because, you know, once you have it, you're not completely immune to it. You know, or that immunity doesn't last indefinitely. So, you know, there are some cases of people getting it a second time. And so we need to sort of avoid that idea of, well, you know, the more people that get it, the faster we'll get there. And so, you know, it just isn't the case.
Right. Yeah. I mean, clearly we're in the midst of this pandemic, and we're facing Thanksgiving. And so the correlation there is that's exactly what happened in 1918, is that they had surging rates. Well, what you have to remember is World War I, the war to end all wars, as it was called then, had just ended. And Armistice Day, which we just celebrated last week, is November the 11th, the 11th hour of the 11th day of the 11th month. And that's still celebrated as Armistice Day. And people broke out in celebrations for Armistice Day. They had parades and gatherings, and everybody was celebrating. Well, the virus, the pandemic was very much with everybody in November of 1918, and that caused a surge.
Right, and that was an influenza pandemic.
Right, the H1N1 influenza, called the Spanish flu. And so you have this, in October, I think in October, 195,000 people died in October alone. So this was a very virulent virus. It was really destructive. And the death rates were much higher, I mean, in the millions. And so by November, the armistice had been signed and people wanted to celebrate, and they wanted to celebrate the holidays. They wanted to celebrate Thanksgiving at that time. And so, interestingly enough, there was a major anti-masking campaign, and there were organizations, the San Francisco Anti-Masking Organization, that said, no, we have to get rid of these masks. And they had celebrations that we're going to celebrate and get rid of our masks because we're tired of wearing these gauze masks around. And so, and then you have the armistice, you have the anti-masking campaigns, and then you have Thanksgiving. And people just wanted to get together again. They wanted to go to church. You know, churches, as today, churches had been closed down. So people wanted to go back to church services. They wanted to do their volunteer work that they typically do. They wanted to go to football games, which had been shut down. And they wanted to have family gatherings for Thanksgiving.
Right.
And so you have this, again, this confluence of factors. And what happened is that people opened everything for Thanksgiving, for gatherings. Right. And then you have another surge. And so you have what's called the third wave by January. By January, 675,000 people died. So you had 195,000 people died in October. By January, 675,000 additional Americans had been killed. Curiously, the car manufacturer Dodge was built by two brothers back at this time. Those brothers died of this flu. The Dodge brothers died of the H1N1 flu. They developed a cough, and within a few days, one of the brothers had died, and a few weeks later, the second brother had died. And so this ravaged through the country. I think I mentioned on this program one other time that my great-grandmother was sort of an herbalist. There was a little village in Pennsylvania, and she took care of the people during the pandemic.
She was a witch doctor.
She was a witch doctor.
She wasn't in Salem.
That's right. She survived Salem, but then went on to Pennsylvania and treated people with herbs and poultices and things. She would drop things off at people's houses. She did not die of it, nor I think did any of her family. But so she remained healthy, but again, mysteriously remained healthy. And there's so much we don't know about these viruses. The other thing is that we're hearing news about the vaccine. They developed a vaccine for this virus in 1918, but they didn't know much about viruses then. And so they developed a vaccine for bacteria, and they gave it to people, but it didn't work, because it was for bacteria, not a virus. Today, I guess this new virus is pretty slick. It's a genetic mutation, it happens at the genetic level. But one of the problems is it has to be kept at negative 94 degrees below freezing Fahrenheit. And so the problem is going to be how do you transport something that has to be kept at minus 94 degrees? And so that's the challenge, but it's a distribution challenge. I guess there's going to be, the virus will become available probably not until, for most people, 2021.
Right. And I think that, as we look back at that, that epidemic from, 1918 and 1919, I think that what they started to implement then, because they made it a law, right? Where you had to wear masks. and they were arresting people
Right.
for not wearing masks.
Right.
Which doesn't sound.
And guess what happened?
But they, of course, a lot of people end up getting arrested.
Right.
And so that caused some problems and things like that. But, we know they knew then, and we know now that masks help.
Right. Right.
I mean, it's clear when you are wearing the mask, the spread slows. It doesn't stop it completely.
Right.
But it slows it.
Right.
And when there's a mass movement to stop wearing masks,
right,
the spread increases.
Right. Yeah. That's what this tells us. That here we can look at 1918. Forget about, if you don't believe in. I'm going to talk about believing in science in a second, but here we have this pandemic, and we saw exactly what happened. Every time people stopped wearing masks, and every time people gathered in groups, especially indoors,
right,
you saw the spread. There was an Armistice Day parade. I forget the cities, but one city had a parade and one city didn't have a parade. And the city that had the parade saw a significant surge in cases. The city that didn't have a parade didn't see that surge. Right. And so it's very clear from this previous pandemic, the 1918 pandemic, that large gatherings without social distancing and without masks spread these viruses.
These types of viruses, absolutely.
Right. And the person this article that we're talking about appeared in USA Today a day or so ago. And the writer quotes Howard Markle, who is a professor at the history of medicine at the University of Michigan, and he also co-edited a book about the epidemic of 1918, 1919. And he said, as people are talking about, well, even if you mandate mask wearing, what are you going to do with people who don't? Because you can't find people. You could, but how do you find somebody who has no money?
Right.
And also, you're going to overwhelm the court system, which is exactly what happened in 1918. That so many people refused to wear, and they were arrested, and they clogged up the court system, so they had to stop arresting people. Our court system, like our hospitals, has a limited capacity, and so you can't arrest 10,000 people.
Right.
You take a large city of a couple million people, you can't arrest several 100,000 people for not wearing masks. Our court system can't deal with that. Right. So we're facing the same dilemma now as we did in 1918. So we can look at 1918 and say, what happened then? And that'll give us a good picture of what's happening today.
Yeah.
And in this, and Markle says, if history tells us anything, it's that the risk of contracting a virus and spreading the virus by congregating in groups and even traditional holiday parties is right now too great. And so Fauci and Markle and all these other people are quoted in this article, and they're saying, I'm not going to do Thanksgiving as we have done it in the past. Fauci, I think, has 2 daughters. And he's been a very busy guy, and he said he missed a lot of their growing up. And he really looks forward to seeing his daughters. He's in his 70s,
right, and
he wants to spend time with them. But the family has agreed not to get together this Thanksgiving because they don't want to travel and they don't want to congregate. They fear spreading this virus, getting it, but spreading it is also an issue.
I heard an interview with Mitt Romney on a podcast the other day, and they were talking about these issues. And he has, I think he said, 25 grandchildren. But they were talking about, what are you going to do for Thanksgiving with all this? Right. And he said that of all of his children and his grandchildren, he said that there's one group that he's going to meet with because they've already that family has already had it somewhat recently, and are recovered and testing negative and everything. And so they're gonna meet with them, but they're not going to meet with anybody else in the family. And I think that's sort of the next part of this podcast, is to talk about the reality that, as is the case with anything,
right?
Depending on or relying on absolute abstinence is not a very effective way to do it. And I like what you said a minute ago. You said that they talk about how they're not going to do Thanksgiving in the traditional way that they've always done it.
Right.
They're still going to do it. They're going to do it
Right.
differently, though.
Mm-hmm.
And you know, everyone keeps, well, not everyone, but many people who are proponents of, you know, that are certainly proponents of mask wearing and social distancing,
Mm-hmm.
something like that, they're immediately going to, well, we need to not meet at all. You know, families just need to cancel the holidays. And that's not going to work. You know, the reality is especially in countries like the United States, most people in the United States don't like it when other people tell you what you can't do.
That's right.
So as soon as you tell them you can't
Mm-hmm.
do this,
Right.
You're going to create a situation where there's going to be some resistance to that. So
Right.
instead of talking about abstinence, we should talk about some other strategies.
Mm-hmm. That's right. And that's what the second part of this podcast is about today, is that the title of it is Demanding Thanksgiving Abstinence is Not Public Health. This article was written by a physician. It was posted just a few days ago. And in it, he argues that that to insist on abstinence is not an effective public health policy.
Right.
This virus is a public health issue. And what I like about this article is there's several things I like about it. One is that he takes a more reasoned and reasonable approach. You can't put everybody in jail for not wearing a mask. You can't fine everybody for not wearing a mask. We know that that's not going to work. But if you take this from a public health perspective, Thanksgiving is going to occur.
Right.
38%, there was a survey done, 38% of people plan to gather with 10 or more people for Thanksgiving.
Right.
And just a third said that they're going to wear a mask.
Right.
That's probably an underestimate.
Sure.
Because people tend not to admit that they're doing something that
Right.
is not socially desirable. So,
and you know, how many of those people say, oh, well, there's going to be 9 people there, and then you actually get there and there's 13, you know?
Right.
So,
right.
Okay.
And we promise to wear masks most of the time, except when we're eating.
Right.
Now, in Florida, we have an advantage because in November, we can still eat outside.
Right.
I mean, it's still warm enough that we can be outside. But if you're living up north, it could be snowing and cold, and you're not going to do this outside.
Yeah.
And so
last weekend it was hot.
It's still hot and humid here.
Oh, it was terrible.
That's right. You're playing soccer now, so yeah, you're aware of that. So we're looking at 40 to 50%, approximately half the people in this country, plan to have a regular Thanksgiving. Right. Now, if you remember the article that we just talked about, that kind of gathering could cause a surge. Okay, that could be a super spreader event. Be that as it may, people are still going to be doing this. Okay, so what struck me about this article is that he said very clearly, despite the damage, despite the deaths, despite the hospital crisis, right, the desire for human connection is so great that we're willing to take the risk.
Right.
And in our field, we talk about Abraham Maslow,
right,
Maslow's needs hierarchy.
Mm-hmm.
And the first set of needs are survival needs. You have to have food, clothing, shelter. The second set are connections with other people. Right. So wanting to get together is a basic human need, which all of us understand, and we all want to do that.
Right. We say that on this podcast a lot. We often refer to ourselves, you know, humans are very social creatures. I mean, we are designed on an almost genetic basis to be social. Right. Because we know that that's why, you know, social isolation and isolation, you know, punishments in prisons and things like that are so effective in damaging people. Because because we're not made to be isolated.
That's right. Yeah. Solitary confinement.
Right.
In prisons, we know how destructive that could be to a person's mental, physical health. And there are legal cases now that are moving toward making solitary confinement unreasonable punishment, you know, and just constitutionally forbid it because it's so damaging to put a person in social isolation like that. So we have this basic human need. People who isolated early in this pandemic, people in some cities, Washington and New York and other places where the pandemic spread very quickly, probably because of public transportation and all that. People who locked themselves down really started to struggle, and they discovered early on that we just can't do this. We cannot isolate. You can't keep people away from each other like this for long periods of time. So instead of abstinence, instead of total lockdowns, we have to figure out, we have to get some public health message that will minimize or reduce your risk, because that's the most you can do. You cannot eliminate the risk. This virus is spreading in the air. It's like part of our oxygen now. And so you can't eliminate. You could eliminate. You could live in a bubble. You could live, you know, not let anybody in your house. And, you know, and I know some people who are doing that, but it's really been difficult for them. And if you're single or if you're a couple, you can do it. But if you have children who are going out, very difficult. If you're working outside the home, it's very difficult. What about doctors and nurses and bus drivers and people cleaning buildings? They're all out there. So from a public health perspective, what we should be doing is looking for ways to minimize or reduce our risk. That's the most you can hope for.
Right. Yeah. And there's a number of questions that we could, that need to be answered as it relates to, you know, what we can do or what we should be doing. You know?
That's right, because with Thanksgiving, we are increasing our risk exponentially. I mean, that's the whole issue here, is that with Thanksgiving, people are going to celebrate Thanksgiving. Please know that you're increasing your risk. Okay, now what can you do about that?
Right. And some of the recommendations are things like, you know, quarantining at home before you go to the gathering so that you know that you don't have it, or having a test done before the gathering so that you know that so that everybody knows that they're safe and they don't have anything before the gathering happens. Now, for Thanksgiving, we're already beyond that point because you can't quarantine long enough before Thanksgiving. We're 4 days away.
You had to do that last week.
Yeah, you would have, right. But you still can do it like a rapid test. They're not as reliable, but you can still do a rapid test to make sure that you're safe. And just, you know, have everybody go up and have it done.
I had to go to Tampa on Thursday. I work in Tampa on Thursday. And I drove by Raymond James Stadium. And there had to be a mile line long of cars waiting at there, because Raymond James is a testing site for COVID. And so I have no idea how long those people waited in line. That was last Thursday, probably in preparation for, but still, I don't know where the sites are in our area. But I saw these sites in Tampa, and they're overwhelmed. I mean, it's just miles of cars waiting to be tested. I couldn't figure out what it was, and I realized it's COVID testing. So yes, you could get tested. My daughter lives in Washington. She's now being tested, I think 3 times a week because of her job, because she's in contact with people who that they don't want to put at risk. So one is you could quarantine or get tested.
Yeah. Some other things is to think about what you can do at, you know, when you're actually gathering. You know, it's always a good idea, as we talked about a few minutes ago, it's always a good idea to try to do as much as you can outside. We know that being outdoors helps decrease risk of spreading, because with the wind blowing and with, you know, it's just an open air environment. Anytime you're in a closed in, contained setting, especially if it has central heating and air, you're talking about just recirculating the same stuff. And so, you know, it's important to do as much as you can outside.
Right. Yeah, you have this bigger space, and so it disperses in a bigger space, whereas inside you keep it contained. And especially, I think of people up north who have their furnaces running, and you have all these people in this enclosed space, and it's going to continue to circulate through the house. And that's what increases your risk, is this recirculated air. You're not in an airplane that scrubs it. You're at home and it's not being scrubbed.
Right. It does make me wonder, and this is not a recommendation for a research trial or anything like that, but it does make me wonder if we know that this virus doesn't do well in the heat. And so it does make me wonder if being in a home where, that's being heated, if that would help at all, especially in light of the, what we've read about the shot, I don't know what vaccine has to be kept at such a low temperature, and that's because the virus is so sensitive to heat.
Right.
It makes me wonder if that helps at all. But
yeah, it might. As it turns out, you might be better off in a hot house up north.
Everybody should just have a sauna at their house, and you should be fine.
No, just turn up the heat.
Not recommending that. That is not scientific. We have no idea.
Right. No, so there are things you can do. What should government do? Does government, from a public health standpoint, do governments have the responsibility to close streets and set up tables? So people can eat outside and put heat lamps out. What is the government's role? So do you want to, you want to do everything you can to keep people outside. Right. You don't want to do things that drive people inside. Church services, for example. In many churches, Thanksgiving is a major celebration in many churches. What are they going to do? And what should they do from a public health standpoint? And then when it's all over, should you quarantine?
Right.
You've been exposed to a lot of people in a high risk setting. Right. Do you now have the responsibility to self-quarantine for a couple of days, maybe for a week or so, to make sure that you don't have symptoms? And then you can, because what you don't want to do is get infected for Thanksgiving and then spread that virus by going to work on Monday.
Right. And that's a big risk. And look, again, the unfortunate reality is that, most of us will be going back to work on Monday.
That's the thing. This is Thursday.
Yeah.
And so you're going to have symptoms.
We're not going to have that opportunity to quarantine. And, so there's the risk.
Right. So you engage in this high risk behavior on Thursday. Symptoms might not appear until the following Wednesday or Thursday. But you go back to work on Monday, you're going to be carrying this virus with you, and you're going to spread it to whomever you come into contact with, whether it's on rapid transit or in a car, at your workplace. Now, and one of the things that, quite frankly, everybody's concerned about is that we do Thanksgiving on Thursday, schools reopen on Monday.
Right.
So now you have the possibility that all of these people are going to recongregate in schools on Monday, and will we see a surge? And
look, the same reality is present for when you think about Christmas. I mean, if you think about the timelines, you have Thanksgiving. So say you're exposed at Thanksgiving. It could be a week to week and a half or so before you start showing any symptoms. So it could be, like we could be a week into or 2 weeks into December by the time you show and demonstrate symptoms, which means that anybody you came in contact with could have it then, could contract it then. A couple of weeks later is Christmas. And so they're going to be, if they are congregating with other people, and if the people who got it are congregating with other people but are not yet showing symptoms, then they're going to spread it. This is how exponential the spread can be. And so we just have to be very mindful that, again, the reality is we're not going to cancel Thanksgiving. Nobody's, one of the notes that we have from the article is that, look at what happened with social media. Right. As soon as it was introduced, the idea of canceling Thanksgiving, it just went viral. It was like all over the place, and it just created anger and frustration and all these negative emotions as a result of, the use of social media to try to encourage folks to cancel Thanksgiving. People get very defensive about that. They already had to cancel Easter. They already had to cancel 4th of July celebrations.
Cancel the football season, essentially,
exactly.
sporting events.
And they had to have an abbreviated Halloween even, you know, for those who are really concerned about that. And so Thanksgiving too.
Right, right. And then, and we're going to talk about social media right when we get to the end of this, but it makes this excellent point that I loved about this article. He said, public health is a service industry. It's not meant to imprison, but to empower.
Right.
And so that message needs to get out, that when we talk about public health, we're not talking about shutting everything down. Right. We're talking about living our lives in such a way that we stay safe, okay? Right. We have to provide options for people to do the things that they are going to do. Americans are going to celebrate Thanksgiving.
Yeah.
And they're going to celebrate Christmas. Okay. So what public health experts should be doing is providing safe ways to do that. What do you have to do it safely? We know you're going to do it. What do you have to do it safely? And one of the problems is, as you mentioned, social media, because whereas social media can spread messages, what goes viral on social media are the extravagant messages. In other words, we want to lock everything down. That goes viral. Right. We want to not wear masks. That goes viral. Right. The responsibility of public health is to get a clear, consistent message that gives people information that they can use to live their lives responsibly and safely, and to reduce the risk. You're not going to eliminate the risk. You can't, but you can reduce the risk. Absolutely. And social media shares some of that responsibility.
Right. And if we know that such a large percentage of Americans are planning to meet for Thanksgiving and planning to meet maybe even in these larger groups,
right?
You know, trying to scold or shame or humiliate or punish those individuals is not going to be an effective means. Right. I mean, we've seen this time and time again, where we try to use those punitive means to get or encourage change, and it just doesn't work.
No, it didn't work in 1918, as we discussed. It's not going to work today. Right. You know, you're not going to let's be reasonable. There are many people who are simply not going to wear masks.
Right.
Now, if you want to go out and you wear a mask, you are going to encounter people who aren't wearing masks. And there's absolutely nothing you can do about that. Right. Okay. All you can do is minimize your risk. Okay. So don't do what you have to do to minimize your risk. You're not going to shame people. You're not going to scold people. Don't bother telling. Somebody told me a story about somebody went to Disney World, and you know, there was a woman complaining about somebody with a mask. And well, what are you doing at Disney World? You know, if you don't want to be, if you're afraid, then don't go to places where there are large numbers of people, because there are going to be large numbers of people who are not wearing masks.
Absolutely.
Okay. Absolutely. So you have to be smart and careful and reduce your risk, because not everybody's going to wear a mask. Not everybody is going to practice social distancing. Okay. Right. But this is a time when we all know, especially during an election year, that social media, especially the messages that go viral, social media is outdistancing public health. And it's time that, and what I like about this article is he's saying, let's put public health back where it belongs. Right. But you have to be reasonable. We have to make reasonable requests. Public health is not shutting things down, lockdowns. It's keeping people safe. It's minimizing risk. Right. That's what we should be doing.
Absolutely. And so as you're looking forward or looking ahead at the holidays and the upcoming Thanksgiving just a few days away, the Centers for Disease Control and Prevention, they have some recommendations, and we have a link to that in the show notes. But it's a lot of the things that we've been talking about. You know, wear a mask, practice social distancing. You know, try to be outdoors if you can. But you know, the other things that are pretty consistent: wash your hands. I like the idea of bringing your own things, bring your own food, beverages, and utensils. How many times do you think about, somebody coughs into their hand, opens the door, and a few minutes later, you don't even know that it happened.
Right.
Go and open the door. Then it spreads very easily. So, just being mindful of those things. And so bringing your own food and utensils and beverages and wearing a mask. All those things are important.
Right. And for those of you who do plan to get together, probably more than half of us are going to in one way or another, and I think it's probably more than half.
Right.
We are going to get together. We are going to celebrate Thanksgiving in one way or another. I would encourage you to go to this CBC website. We posted in the show notes, and they have very practical, very simple to follow instructions. If you're flying, if you're driving, if you're inside, if you live up north, if you live in the south, really a whole collection of very easy tips for staying safe and keeping others safe during the holiday season. So if you are traveling, if you are going to celebrate the holidays, take a look at that. It'll just take a few minutes to go through it. Yeah. It's really good advice from people who know what they're doing. I meant to mention when we were talking about the vaccine, everybody's been waiting about the vaccine. Everybody's been waiting for the vaccine. Okay, the vaccine is going to change it. The vaccine is going to get us out from under this pandemic. I want to remind everybody that in the last year or two, science has taken a huge hit by politicians in particular, and it's been criticized. Scientists have been pushed to the side. Science has been ridiculed. We don't want the specialists here. We don't want people telling us what to do. Keep in mind that the same science produced the vaccine. Okay, that the same science you're criticizing is producing the vaccine. Right. And you can't pick and choose which science you want. The iPhone 12 is coming out. Yeah. It's the same science produced that. So be very careful about ridiculing the scientists, because the same scientists we're ridiculing are bringing us the vaccine that could end this thing. So I do make that request, is that we be careful about how we treat our scientists.
Absolutely. Absolutely. So, all right. Well, that is it for today. We hope you all have a very happy and safe Thanksgiving. We will do our best to do the same. So yeah, until next time, stay happy, stay healthy, stay healthy.
As never before.
Exactly.
Right?
Don't forget to be afraid.